Good day, everyone. In this video, we are going to introduce the 6 meridian syndromes briefly. It is almost impossible for us to study in details of the 6 meridians. The reason is because the 6th meridian differentiation is a 1 year or at least 1 semester course. We can study the 6th meridian alone for 1 year. So since it is not a very important or not the key differentiation methods that we are going to apply, we're going to introduce this 6th meridian differentiation methods briefly in a few videos. And then from the introduction, you will know that in general, how are we going to identify different syndromes from the 6th meridian? In each meridian, in each syndrome, what are the common manifestations and why? How to analyze? So the first one, the Taiyan syndrome. The Taiyan syndrome can be divided into Taiyan meridian syndrome and Taiyan Fu syndrome. So we're going to study the Taiyan meridian syndromes first. The Taiyan meridian syndromes can be further divided into wind attack or cold attack. This is the disharmony between the yin and wei defensive qi. This is the first or the initial stage when a pathogen invades our body. The patient may present with chills, headache, neck rigidity, superficial pulse, or floating pulse. Taiyan. When we talk about Taiyan meridian, especially the foot Taiyan meridian, is the foot Taiyan bladder meridian. The foot Taiyan bladder meridian starts from the eyes, in the corner of the eyes, goes all the way from the head, all the way to the foot. So Taiyan meridian is one of the longest meridians in the body, and it travels all the way from the head to the feet. The Taiyan meridian syndrome mostly related to the meridian. So in this situation, the pathogen attacks the human body, especially from the coldness, attack the body, chills, or fever. The headache and stiff neck, that's because of the meridian. As you can see from the previous slides, the meridian, the foot Taiyan meridian, runs all the way from the head to the foot, travels from the head through the neck to the back. So once the meridian block in the head and in the neck, the patient will feel headache and neck rigidity or stiff neck. The pulse is floating. That's because this is the initial stage. The pathogen, the early stage, the pathogen attack Taiyan meridian, attack the superficial of the body. So the wei defensive qi or the anti-pathogenic qi fights with the pathogens in the superficial level of the body. The anti-pathogenic qi, when they fight with the pathogenic qi, the pathogens, this pathogenic qi we call wei defensive qi. So the anti-pathogenic qi, when they fight with the pathogens, we call wei defensive qi or wei defensive yang. The reason why here weight defensive yang is only because we want to emphasize the yang. The yang has the function of warming. So the Taiyan Meridian syndrome, the patient will present with chills, headache, superficial pulse, or flopping pulse. Taiyan wind attack and Taiyan cold attack. Taiyan wind attack, the patient will present with fever, aversion to wind, headache, spontaneous sweating, and delayed pulse. Superficial must be superficial, so the Taiyan wind attack syndrome and the Taiyan cold attack syndrome are all Taiyan Meridian syndrome, so it will share the similar manifestations: headache, superficial pulse. So that's the shared manifestations. Why the Taiyan Meridian syndrome, the Taiyan wind attack syndrome, will aversion to cold and fever? That's because the wind attack the superficial. That's the fever come from. The wind attack the superficial, the security of the weight defensive qi. That's the qi's confining function being affected, so it will cause spontaneous sweating. The pulse is still superficial, so that's the key manifestations: aversion to wind, sweating, superficial delayed pulse. The differences between the wind attack and the cold attack, Taiyan cold attack, is sweating or not. This is an exterior access syndrome. So the Taiyan wind attack is an exterior deficiency syndrome. Exterior syndrome, the patient may present with headache, superficial pulse, neck rigidity, body ache, rapid breathing, absence of sweating. Why the patient will have absence of sweating? So you can go through the first few sentences by yourself. But the absence of sweating, the coldness block the superficial. So the coldness block the superficial skin. It kind of freeze the superficial skin. So the pores were closed. That's why the patient will be absence of sweating. The patient may present with rapid breathing, tense pulse, because of the coldness. So the key manifestations will be headache, superficial tense pulse. And in this manifestation, the patient will have no sweat, absence of sweating. So that's the differences between the wind cold attack and the Taiyan wind attack and Taiyan cold attack. Also from the name, the name of the syndromes, we will know the etiological factors. One is due to the cold, one is due to the wind. Taiyan Fu organ syndrome. The Taiyan Fu organ syndrome mostly refers to the bladder. The reason is the foot Taiyan meridian. It's the bladder meridian. So mostly Taiyan Fu organ, Zang organ and Fu organ. Fu organ mostly refers to the bladder. And this can result into two syndromes: the water retention, Taiyan water retention, and Taiyan blood stasis. Taiyan water retention, the patient will have fever, chills, sweating, lower abdominal fullness, thirsty, vomiting immediately after drinking water, superficial pulse or superficial and rapid. So why superficial? That's because although this pathogen goes to affect the blood, that's the internal organs, but this pathogen still Taiyan diseases. Taiyan diseases is a superficial diseases. So in this situation, the patient also actually suffer from superficial and the pathogen affects some of the internal. So this is a combination of superficial and internal. That's why the pulse still superficial. But from the manifestations, the patient may present with some blood manifestations. Vomiting immediately after drinking, that's because of water retention in the body. The abnormal of the water distribution in the body, the patient will feel thirsty because the function of the distribution, the normal function of the distribution become abnormal, so the patient will feel thirsty. But remember, that's a water retention. In the body, the patient will have excess of water. That's why the body does not want any more water. The patient feels thirsty, so he drinks. When he drinks, he vomits immediately because the body does not like the water. So these are the analysis. The key manifestations. Patient must have dysuria, either dysuria or other abnormal manifestations of urination, such as frequent urination. It also can refer to Taiyan Fu syndrome. Taiyan Fu syndrome is the manifestations of the bladder plus Taiyan Meridian syndrome. What's the Taiyan Meridian syndrome? Headache, body ache, fever or not, superficial pulse, or floating pulse. So these are the manifestations of Taiyan syndrome. Taiyan Fu water retention syndrome. The blood retention. Blood retention, that's because when the pathogen affects the Taiyan meridian, and then when it travels into the interior, it causes blastasis. The patient may present with sputum, hardness and fullness in the abdomen. So when you palpate, you can feel the fullness in the lower abdomen. Normal bladder movements. So in this situation, urination is not affected. Madness, that's the original description in the classic. Madness or insanity, forgetful, poor memory. So this is the manifestation of the blastasis in the heart, or now we can say that's in the brain. The reason how the bladder problem can affect the heart or the brain. For this reason, you can study the meridian, the distribution of a meridian. There's one branches, bladder branches, go to the heart. The black tarry stools, that's a sign of internal bleeding. A deep, hesitant, or deep, knotted pulse. So these are the manifestations of blood retention. Blood retention also can happen especially when it happens in a lady suffer from Taiyan syndrome, or a lady got sick before the period or during the period. Is more likely to happen. So it may affect the, the mind, the mental activities, normal blood movement. So these two are all related to the internal organs, especially related to the 腑 organ, 太阳腑 organ. But one is with abnormal blood movements, urination, dysuria, or frequent urination. And what the blood retention from the normal blood movements, but we have the mental activities problem. So that's the key differences. The Yang syndrome. The Yang syndrome also can be divided into a Yang Meridian syndrome and a Yang Fu syndrome. Yang Meridian syndrome, the Yang Meridian, the foot Yang is the stomach meridian. The foot Yang meridian also travels from the head to the foot, all the way to the foot. Also a very long meridian. The patient may present with high-grade fever. The reason is because the Yang meridian has plenty of blood and qi, perfumed sweating, extreme thirsty, thirst with desire to drink. So this is a very different from the previous one. The previous one drink and vomit immediately. This one is drink first with desire to drink. Red face, redness. As you can see here, this is actually excess heat syndrome in the Yang meridian. Very importantly, the Yang meridian syndrome without dry feces, so without dry stools. The tongue coating is dry and yellow, so that's a heat syndrome. The key manifestations of this syndrome, the patient will have a red face, will have sweat. That's due to the heat, the internal heat. High-grade fever, also due to internal heat. Drink first and searching powers. So that's all due to internal heat. Yang Fu organs. The foot Yang meridian mostly related to the stomach, and then now the Yang Fu organs refers to the internal, the most digestive organs includes the intestines. So the Yang Fu organs syndrome will cause dry feces, dry stool. It will manifest as a tidal fever, more pronounced in the afternoon. So this tidal fever is different from the one become worse at night. Sweatiness of the hands and feet, constipation. So that's the key manifestation, constipation. The constipation will result in abdominal distension, fullness, and hardness. The pain that aggravates upon pressure, that's because of the heat and excess condition. The Yangming-Fu organ syndrome also reflects in the heat. The key manifestations are the tidal fever, pronounced in the afternoon, sweating not only in the hands and feet, excess sweating. Can the patient feel thirsty or not? Of course, that's because of the heat. The patient also can feel thirsty, excessive pulse. So this manifestation can be summarized into four symptoms: excessive heat, excessive sweating, excessive pulse, excessive thirsty. So can be described into these four: excessive heat, excessive thirsty, excessive sweating, and excessive pulse. So this is the key manifestations of Yangming-Fu organ syndrome. Because of the excessive heat and because of the constipation, for the treatment, we can use the treatment method to cause diarrhea. For this purpose, you can either use acupuncture or herbal medicine. To cause diarrhea, then the heat in the body will be relieved. Shaoyang syndrome. The Shaoyang syndrome, as you can see from the previous introduction in the previous video, from Taiyan, Yangming, Shaoyang to Taiyin, Shaoyin, Jueyin. Shaoyang is the last stage of Yang. Is also, although we begin to separate them into Yin and Yang, but in the actual world, there's no line between Yin and Yang. So the last stage of Yang is a starting stage of Yin. So that's the Yin and Yang theory. As we can, until now, you should have this way of thinking, where the Yang starts. That's where the Yin ends. That's in the corner. This corner, when the Yang become pronounced, that's the corner where the Yin become less. So the Yang goes to the Yin. The end of the Yang is the start of the Yin. Shaoyang syndrome is a bit different from the previous two. One of the most important manifestations is the alternating chills and fever. The patient feel fever and chills. Sometimes feel chills, sometimes feel fever. Sometimes feel aversion to cold, and sometimes feel hot. Fullness in the chest, bitter taste in the mouth, dry throat, blurred vision, poor appetite, restlessness, nausea, vomiting. So these are all Shaoyang syndrome. What's the reason? How to analyze these manifestations? The causes of a Shaoyang syndrome. It can be the pathogen developed from Taiyan to Yangming, or from Taiyan to Shaoyang directly. It also can be the pathogen from Yangming develops into Shaoyang in a more favorable direction, from Jueyin to Shaoyang. As you can see, that's a Yin syndrome, from Jueyin to Yang syndrome. Then you can see that the disease is become better. The key manifestations of Shaoyang syndrome, that's a bitter taste, dry throat, and blurred vision. The Shaoyang, the foot Shaoyang meridian, gallbladder meridian. So the heat in the meridian will cause a bitter taste. The heat causes dry throat. Fire, the blurred vision. In the Zangfu meridian, the Zangfu organ differentiation, when we talk about the blurred vision, that's the liver. So gallbladder and the liver are coupled organs. Alternating chills and fever. As you can see here, some of the manifestations you also can analyze from the Zangfu organs. Shaoyang meridian is the gallbladder meridian. The gallbladder and the liver are related. So these differentiation methods are not separate completely. They still have some connections, such as when we study the Taiyan Fu organs, we study the Taiyan Fu syndrome, the Taiyan bladder syndrome. When we study Yangming meridian, we also study the abnormal bowel movement that's from the intestines. Gallbladder heat and qi stagnation affect the stomach qi, will cause a poor appetite, nausea, and vomiting. So this is the liver, the wood affecting the earth. This theory, when we study the five elements, we use the one clause. That's the wood problem will cause the earth. That's from this clause, from the Shaoyang diseases. You will know that the Shaoyang diseases is a disease in the bladder, in the Shaoyang meridian, but it's in the gallbladder, in the Shaoyang meridian, but the patient will present with poor appetite, nausea, vomiting. So the key manifestations: bitter taste, dry throat, blurred vision. Alternating chills and fever. The patient will tell you that they feel cold and after a while feel hot. That's alternating chills and fever. For the alternating chills and fever, you also can refer to the textbooks from the inquiry, fever, chills and fever. We also have introduced the causes of alternating chills and fever. In this video, we have introduced the three yang syndrome, the three yang meridian syndrome. In the next video, we are going to continue to study the three yin meridian syndrome. Thank you for your attention.